Hi, welcome to Fertivision-2017. I'm representing GoDoctor, and GoDoctor is a collaboration platform that connects the global medical community, and we're the official communication partner for the event.
Thank you for the invitation. I'm happy to be here.
Thank you so much. So how are you liking the event so far?
I think it's a great meeting. Today was the pre-Congress courses, and I was participating in the one devoted to ovarian stimulation, which was extremely interesting, very interactive, with a lot of discussion with our Indian colleagues. So I found it very nice. The Congress is extremely well organized, but of course this is not my first time in India, so I've been in many other congresses in India, in the area of my interest, and they are all very well organized and of very high quality.
And can you tell us which country are you from and what's your specialization?
I am from Greece. I was trained in Greece and in the US, in Yale University for 3 years, and I am a professor in the University of Thessaloniki in the northern part of Greece. I'm a gynecologist by training, but then I specialized in reproductive medicine and in vitro fertilization. So that's the area that I've been working mostly over the last many years.
So did you give a lecture today, or are you giving one tomorrow or something?
Well, both. I gave 3 lectures this morning in this course, and participated in the interactive discussion with the participants, and I'm giving one lecture tomorrow morning as well. So it's actually the workshop that I participated today was organized from the International Federation of Fertility Societies, IFFS, of which I was a past president, and currently I'm in the executive board together with our current president, Professor Richard Kennedy, and the executive who is responsible for our education, who is Professor Paul de Vroey from Belgium.
Wow, okay.
So it was a very good team that we were there, and as I said, we had very nice discussions.
What are your talks going to be about? Can you give us a summary of them?
Well, from the whole field of reproductive medicine, I've had a particular interest in ovarian stimulation in women who will undergo in vitro fertilization. So the topics that we discussed today was number one, what are the particular protocols that we can use in women with polycystic ovary syndrome. Then we discussed also what are the preferred protocols in women who do not respond well for ovarian stimulation, the so-called poor responders. And our group in Greece has done a lot of studies on that, so we presented data of what are the options to treat those women. And finally, we also discussed a lot about the current ways to avoid the ovarian hyperstimulation syndrome, particularly in women with polycystic ovary syndrome who represent a high-risk group of patients. And tomorrow morning, my topic is, which I gave partly today, is how do we help women with polycystic ovary syndromes to get pregnant? What are the options that we have? What are the different ways that we have? And how do we prioritize them? What we suggest first, second line, third line, and so on.
So what would you say, since this is an international conference, what would you say is the best country for one of those women to go to receive vitro? Does it vary a lot?
Well, there are differences. Number one, there are differences in the world because there are differences in regulations and legislations. Mm-hmm. So certain things are maybe allowed in one country and maybe not allowed in other countries. So this creates some differences, but also some inequalities in access to care. On the other hand, I think there has been a lot of progress over the last years. I had the privilege to work in the field from when it started, in the early 1980s. And so I've followed all this gradual evolution and development of the field. I think, in order to be more specific, that India does a lot of activity, is very advanced in reproductive medicine. They have a lot of IVF centers. All modern techniques are being applied here. So I think that women and couples here have very good care by our Indian colleagues, and they who participate also very actively in the congresses, not only in India but also abroad. I see them in the meetings that we organize in Europe every summer, in America at the ASRM and so on. So they are extremely interested and they follow the developments. So I think that they are the level here is very good, and that's why we had very lively discussions about the issues, because the current focus of in vitro fertilization, but also ovulation induction, is how can we make the treatment as effective as possible, but also as safe as possible for the woman. And therefore we discuss strategies that we can maximize the success and at the same time minimize the complications or health risks. And this is, I think, a very important discussion.
Is there ever any talk about mental health along with those kinds of patients? And
yes.
What hope is that?
Yeah, the answer is yes. There have been studies showing that many of these couples undergo a lot of stress, guilt feelings, and so on. These things have been studied extensively, and actually all the professional and scientific societies, they have special interest groups dealing with the mental issues related to infertility per se, but also related to the treatments. And we are trying to find ways to minimize the stress. It's part of what I was saying, to reduce the risks and reduce also the strain for the couple and particularly the woman.
So, is there anything new you can tell us about your research? Or one last question.
Well, I think
anything surprising you found that you can share?
Well, I think the relatively new, as I mentioned, is the fact that now we have a way practically to eliminate the most dangerous complication of ovarian stimulation, which is the ovarian hyperstimulation syndrome. But I think my colleague Professor De Bruy will also talk about that. So I think this has been a very nice development. Then another important development that has applied the last few years is to reduce the number of embryos we transfer, aiming to transfer one embryo at a time, which in a sense has eliminated multiple pregnancies, which despite what people sometimes believe is a complication, because it's a higher risk pregnancy, even twins. So that's something we are discussing. Then there has been a lot of progress trying to identify which is the best embryo, the one who has the most potential to implant, so that we can choose and transfer it. Then another thing that has developed a lot and is very important is the cryopreservation of embryos and transfer embryos at a second subsequent cycle. And that has also gained a lot of momentum because it has a lot of advantages. So these are all issues that we discussed and we are going to discuss in the context of this Congress here.
Okay, great. It sounds like science fiction, but it's real.
It's really reality, and it has helped millions and millions of couples to have a healthy child.
Thank you so much for sharing.
Thank you very much.